All right, here we are. Thanks so much, everyone, for coming. I'm Dr. Elena Traister here in MCLA's Environmental Studies Department, and we're glad that you're joining us for this Green Living Seminar presentation. These, as many of you know, take place every Wednesday evening at 5:30 here in the Feigenbaum Center for Science and Innovation, room 121 on MCLA's campus. They're free and open to the public. And we will have a speaker joining us today. We'll hear from her for about 40 minutes or so, and then we'll have a question and answer session at the end, so I hope you have lots of questions to ask then. Before I introduce her, just a quick encouragement that you come back again next week. On February 19th, next week on Wednesday, we will be hearing from John Leibowitz, President and CEO of Northeast Wilderness Trust. He's going to present a lecture titled Rewilding in an Unlikely Landscape, the Recovery of the Northern Forest of the Northeastern United States. Today's presentation, titled Restoring Forests to Reduce the Spread of Disease, will be given by Dr. Paula Prist. Dr. Prist is a Senior Program Coordinator for Forest and Grasslands Unit at IUCN, International Union for Conservation of Nature. She holds a master's, doctorate, and post-doctorate in landscape ecology from the University of São Paulo, with a sandwich period at Columbia University and the University of Queensland. Her line of research focuses on trying to understand how to create healthy landscapes for people, with a focus on multifunctional landscapes that can mitigate climate change, provide ecosystem services, and also provide positive health outcomes. We are so glad to have you joining us. Thanks so much. I will turn it over to you.
Thank you, everyone. So I'm going to share my screen. If you're not seeing my slides, please let me know. Everyone can see what I'm sharing? Okay, so when I was putting this presentation together, I was trying to focus only on the restoration side, but then I thought that I would need to incorporate the basis of what we are doing, that is really trying to understand how restoration can have win-win benefits for human health. And then I decided to give a more broad presentation about healthy landscapes that also talks a little bit about deforestation, but this is all the basis to go to the restoration side. And I'm going to also talk a little bit about landscape ecology. I don't know how much do you know about that, but if you don't understand anything, just please interrupt me at any time. Just feel free to speak, to ask any questions, and then I can answer, or I'm from Brazil, so if you also don't understand my English, just please interrupt me at any time and just ask me to go back, and then I can say again, okay? So I'm going to talk a little bit about how we are trying to establish these guidelines to plan for those healthy landscapes, mostly in tropical countries. This is most of my research was done. And this is going to incorporate both deforestation and forest restoration. And I always like to start talking about the COVID pandemic. And I know that I'm not talking about the pandemic per se, but I think that for me, and I'm a very optimistic person, this was the first time that those links between environmental degradation and human health, they were everywhere. Everyone was talking about that. And this was something that we were studying for a long time. And it was not only those links about pandemic prevention, zoonotic diseases, and deforestation, but also people start talking about how people in quarantine, they were not having those connections with nature, and they were being more affected by mental health issues, or how forest restoration could be a solution to prevent new pandemics. So for me, I think this is a very, despite everything, of course, a good momentum for us to really show the world of those very strong links that exist between nature conservation and human health. And I just want to start saying that I think we all know that the COVID-19 pandemic was not the first pandemic that the world faced. Like, we had several pandemics happening in our story. I'm not going to mention any of them, but I just want to say that from most of the pandemics that we had now in our history, most of them, they had a zoonotic origin. And what is these zoonotic diseases? So they are diseases that are transmitted from animals that can be both domestic and wild to humans. And the opposite is also true. We can also infect animals, and we can sometimes just threaten endangered species and populations because we're just infecting them with a virus that they were susceptible. And we didn't really heard a lot about those zoonotic diseases before the pandemic, but they represent a huge burden. So when we look at the numbers, we see that 60% of the pathogens that we know today, they have a zoonotic origin. And I say a zoonotic origin because sometimes, like COVID, we have the first event that was a zoonotic origin, like a spillover between an animal and a human, and then the pathogen, normally a virus, developed to this human-human transmission, and then it's just very, 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 very hard to stop the spread. So what we need to do is really try to avoid this first spillover event. And from these non-pathogens, most of them, they are emerging infectious diseases. So 75% are pathogens that are increasing in their emergence. So this is showing that they are becoming more common and more frequent in these current days. And most of them, 72%, they originated in wild animals. But how do you think a person can get infected with those zoonotic pathogens? Do you think it's easy? Like, because we always talk about those spillover events and people get infected by Ebola or other virus or Lyme disease, for example, but it's not that simple, in fact. I normally say that for a person to get infected with a zoonotic event is a very rare event because you need to have several mechanisms and several things happening at the same time and space. So, for example, this risk framework that was adapted for zoonotic diseases, I really like this because it really shows how this issue is really, really complex. So what do you need to have in order to be infected or to have a chance to be infected? First thing, you need to have the hazard. And what is this hazard? This hazard is the presence of species that can transmit diseases, a certain abundance, because if they are more common, it's more easy for you to find these species and potentially get infected, and also the pathogens that they carry, and what is the frequency of infection that these species have. However, I can have an environment that is populated by species that can transmit diseases. They're all infected, but I don't have people in there. So I have no risk, because to have risk, I need to have people in contact with those animals. And this is what we call exposure. And it's not only having people sharing the same habitat, but it's also having risk behaviors that can threaten or can put them in contact with those animals. So for example, if I live in an area close to a forest, but I never leave my house, I have zero contact with any animal. But in the opposite, if I'm going to the forest, if I'm hunting, if I'm collecting wood or other forest materials, I'm putting myself at risk every time, and I increase my exposure rate to those hazards. And then I will have a chance of getting infected. But even so, this is so complex that sometimes you have everything. You have a lot of animals that can transmit diseases. They are highly abundant in that landscape. They are all infected. You are in exposure with them. You are being exposed to those animals every day, all the time, but we don't know why. You just don't get sick. This happened a lot with COVID. Like I have a family member that is a doctor, and he was working in the intensive care with COVID, and he didn't get infected. Even like he was not wearing masks or anything, because he felt that this close contact with patients were better for their recovery. And we just don't get it, but that happened, and this is what we call vulnerabilities. And you need to have all of this happening in the same space and time. So it's not that easy to really get infected with that, but it happens, and is being more frequent now, especially because we are disrupting the environment for those hazards, and we are putting people in the middle of this anthropogenic habitat in close contact with those animals. And this is one of the reasons that land use change today is appointed as one of the major factors of the emergency of zoonosis. And this study says that more than 30% of these new diseases reported since 1960, they are connected to land use change. However, I want to ask, I don't know if you, please just jump if you want to answer. For you, in your perspective, what is land use change? When we talk about land use change being one of the main drivers of disease emergency, what do you think that is land use change? Because the first thing that we think about is deforestation or habitat loss, right? Not only forest habitats, but the loss of native vegetation habitats. And this is true. Like we are seeing that, just a note that most of the tropical areas are already deforested, and like 75% today of the deforestation, of course, on these areas. And we have some hotspots of deforestation that happens in Brazil, Congo, and Indonesia that are also the most biodiversity countries in the world. And they host a high number of pathogens. And some studies say that every time you deforest, for example, 1 kilometer square of the Amazon, you generate 27 new cases of malaria just because you are putting more people in contact with those mosquitoes. But when I talk about land use change in a landscape ecology perspective, I'm going to go back to that. I just want to state that land use change can be anything. Can be forest loss, but can also be forest growth. If I'm replacing a pasture to a forest, for example, this is land use change. If I'm replacing a pasture to soybean, to sugarcane, and etc., this is all land use change. So when we say that land use change is one of the main drivers of disease emergency, probably we're talking about deforestation, but we are not sure. So this is just to state that we almost know nothing about those drivers of disease emergency. We are just starting to understand those mechanisms. And there is still a lot of research to do because we don't really understand how those landscape dynamics affect disease emergency. But for the deforestation one, there are several mechanisms that happens when we replace those forest areas by anthropogenic habitats, mostly pasture or soybean, for example. And one of them that I think is really easy to understand is the fauna community simplification or homogenization of the fauna communities. That happens because when with the forest, a lot of species, they cannot live in this new anthropogenic and degraded habitat, the specialist ones, and they end up disappearing. And then we end up selecting just a few pool of species that are the generalist ones that can really live and they end up thriving in these new environments. And what we are seeing is that most of those generalist species, they are the ones that can transmit diseases. I'm not saying that the specialist ones, they don't transmit diseases, but what I think that happens is that because you just increase so much the abundance of those generalist species, they just have a higher chance of contact among each other. So they get more infected too, because a lot of those viruses, the transmission of those viruses, in some cases, they require this intraspecific connection, contact. So when you have a higher abundance of these very specific species that can host this pathogen, they just have a higher contact rate and they just end up getting more infected. And then of course, the chance of a person to enter in this environment and find an infected rodent, for example, is so much lower than in this environment. So if someone is going to hunting here, the chances of this person to find an infected rodent, excreta, and get infected is so much higher than in a natural environment. So this is one of the mechanisms. However, what we don't know is if all deforestation is the same. Because when we look at conservation studies that are trying to understand how deforestation is affecting, or forest loss is affecting the maintenance of species, we can see that there is, at least for tropical areas, a very clear threshold that shows that, at least for birds, small mammals, and amphibians, you can deforest at least 60–70% of a landscape and still maintain a high richness of species, with a lot of specialist species and a community composition that is very similar to a more forested landscape. So this would mean that potentially deforestation is not that bad if we know how to do it, and if we know how much we can deforest in which context to really keep those communities in a complex way with their functions, and really trying to preserve the specialist species and keeping the abundance of those generalist species low. And this is really important because we just had the Biodiversity and Health Action Plan being approved at the last COP. And this states that we need to integrate those linkages between biodiversity and health into every land use planning that the countries are submitting to the GBF and the CBD. So this means that every target that the entire world has, that is to conserve or restore forest areas, they need to incorporate those health linkages. So they're starting thinking about that. However, those examples that I mentioned here, they happen when you talk about birds, small mammals, amphibians. But what happens when we have one disease, for example, like Lyme disease that a lot of you know, that involves a lot of different species? So I have ticks involved, I have deer, I have rodents, I have amphibians, sometimes reptiles, in fact. So how do I put all of this together? And how do I can find if those species, they respond in the same way at those landscape changes? So this shows that when we talk about zoonotic diseases and human health, in fact, this is really complex. And we are just starting to understand the general pattern to really try to see how we can really understand what is happening for each disease. And this is just for one example that I want to show that this is so complex that we believe, and we almost have no study about that, but we believe that the amount of deforestation is also going to have different outcomes depending on the context that you are deforesting. So for example, here in the A panel, you can see that you have, before you start your deforestation process, we have 100% of forest cover. And then I deforest 33%, one third. And potentially, this could not have any change in the increases in the risks of those zoonotic diseases in general, because I would still have a huge amount of forest cover, so I could potentially keep my communities like in a complex way, and the abundance of those vectors and the host species in a very low and control. However, if I deforest the same amount, the same 33% in a landscape that already lost 30%, potentially I'm going to have a higher risk than if I deforest in this first landscape, because I already degraded this landscape and I already start changing those fauna communities. And potentially when I reach a number that could be close to 40 or 30, we don't really know, I can have those abrupt changes in those communities, and then I can start really just selecting those species that can transmit diseases. However, if I deforest the same 33% in a landscape that is highly deforested, potentially I'm going to increase a lot the risk, because I'm going to select only those species that can transmit diseases, but then I won't have any more forest cover. So I won't have any more suitable habitat for those species. And at the end, I can decrease the risk for the forested zoonotic diseases, but depending on like for what land use type I'm going to replace, I can just bring other ones. So normally when we talk about zoonotic disease, we split between the urban, that is dengue, Zika, chikungunya, and those other ones that are transmitted by animals that require natural habitats. So we just replace the diseases that are occurring, because when we show this to a lot of people, they say, oh, so this solution is just to deforest everything. And then we say, no, we're just going to replace, and then we're going to make everything worse, because we're going to bring those diseases that are urban, that are very hard to control, and normally they are invasive species. They are being characterized by invasive species like the Aedes aegypti. So it's really, really, really hard to control. But this is just to show that it's really hard to try to understand how we can really, how much we can deforest or how much we need to restore, for example, to really be able to keep or to restore those functions that those species they can bring. And this is only when I mention the landscape composition aspect. I'm not even entering into the configuration aspect. And I don't know if you all know, but when we talk about landscape, the landscape structure is composed by the landscape composition and the landscape configuration. The landscape composition is the type and the amount of each type of land use that I have in a landscape. So for example, in here, I have 5 landscapes, but they just have 3 landscape compositions. So this one has 15% of forest and 85% of other uses. These two, they have 35% of forest and 65% of other uses, and this one is the opposite. But when I talk about configuration, in this case, I have 5 different landscapes configuration, even if they have the same amount of forest cover. And this landscape configuration is the spatial arrangement of those forests or native vegetation patches that are in this landscape. And depending on how they are close, how much fragmentation I have, this can also determine the risk of zoonotic diseases. So for example, when I look at a landscape that has the same amount of forest cover as in here, do you think that for a tick, for example, or for a mosquito that can transmit a disease, those landscapes, they are the same? They are not, right? So in this case, in the left, for a mosquito, maybe he sees that are just one giant forest fragment and he uses it all. But here at the right, maybe it's just 4 small forest fragments, and depending on the distance that they have, they are isolated from each other for this species perspective. And then we will have a completely different response for disease transmission. And just one thing that I want to bring is that sometimes when we talk about deforestation, we always talk about deforestation and habitat fragmentation, but we can and we do have sometimes deforestation that doesn't cause habitat fragmentation. Because habitat fragmentation just happens when I break this native habitat like patches or areas into several different pieces that are isolated from each other. And I can have deforestation and still have no habitat fragmentation happening. And this configuration, a lot of studies, they say that it's really, really, really important, especially when we are reaching that threshold, that value that I showed before, that says that when you reach that value, we are going to lose a lot of species. That some studies say that it is around 30 or 40% of forest cover. And those studies, they show that when we are under this threshold, under this 25 to 40%, what is really, 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 really going to determine if a species can survive in this landscape is the configuration or the spatial arrangement of those forest habitats. And just to show one example, we did one study in the Amazon where we are trying to see exactly that. So we control the landscape composition, we control the matrix type, they were all pasture, and we control the amount of forest cover that those areas had. They all had 26 to 30%, very close to this threshold. And we sample landscapes that are like a more land sparing format, where you have all the forest area like aggregated in one large fragment. And we also sample this, what we call fishbone pattern, that is a highly fragmented landscape. And we were controlling those 2 landscapes with a control site that is, it has 100% of forest cover. And we were using large mammals as example, but we saw that the large property that is this highly aggregated landscape it was able to secure or hold or harbor a similar number of species of those control sites that have 100% of forest cover. And not only the richness, but the community composition was also very similar. And this shows that potentially we can deforest those landscapes at this certain threshold and still keep multifunctional landscapes where we can have agricultural happening, but also a high diversity and all those functionality that these species can bring. And when we were looking at this highly fragmented landscape, we just found a lower number of species, but also only generalist species. So based on that, we are trying to incorporate all these for zoonotic diseases. And I'm going to show a few examples of what we are discovering. And I'm not entering a lot of detail in here because otherwise I can just keep 1 hour talking about hantavirus or yellow fever. So I'll try to be very brief, but please just ask any questions if you have any doubts after I finish. But hantavirus, for example, is a disease transmitted by virus. Is a virus. The name of the disease here in the Americas is hantavirus cardiopulmonary syndrome because it has a very similar very similar symptoms as the COVID. So when you get infected, you start feeling this fever, headache. 90% of the case, they are symptomatic, but the ones that are symptomatic, they can get really bad, and then you have a problem in your lungs, and then you end up dying 3 or 4 days after you get infected. And we have a low number of cases in Brazil being documented, not only Brazil, but in the entire Americas. So on average, we have 200 cases per year. However, when we do studies looking at how many people they had been exposed with this virus in populations living in some areas, we see that at least 20 to 25% of the population, they have antibodies to hantavirus. So this shows that those numbers are much higher than we are seeing. But in Brazil, at least, it is transmitted by these two, I think they are very cute rodents. They are forest rodents, the Necromis lasiurus and the Oligorismus nigripis, and they're just found in this one in forest areas and this one in the Cerrado and in more agricultural areas. And when we try to understand how those two species, they respond to those habitat changes, and we tested several different aspects, not only composition, but also configuration. So forest cover, how much I deforested, connectivity, fragmentation, all of that. We saw that for both species, what is really important is the amount of forest cover. This is the only thing that they really respond. And when we look at those landscapes, we saw that landscapes with less than 15% of forest cover, so highly degraded, they can have more than 300 times more abundance, or like a higher abundance than the ones that have close to 30% of forest cover. And the 30% of forest cover, again, is more similar, have similar abundance to the more controlled sites. So thinking about that, we were trying to understand if those species, they have a very simple response, they just respond to forest cover, what would happen if we restore those habitats? So what happens is that in the Brazil, we have the Atlantic forest, that is this region here in this map, is highly degraded, highly deforested, is where the colonization of the country started in 500 years ago. So more than 70% of this biome was lost. And to try to cover this, we have our native vegetation law that requires that we maintain a certain amount of forest in each property. And of course, no one respects that. So we have this deficit of forest cover that is 6 million hectares just in the Atlantic forest. So we create a model just to try to understand what would happen if our native vegetation law was respected. And if we were able to restore those 6 million hectares, that it should be preserved. in this area. So we created a very simple model, and then we restored the entire Atlantic forest, just increasing the amount of forest cover. We're not concerned about in which spatial arrangement, because for those species, doesn't really matter. And then we saw that for the Necromis lasiurus one, that is this species that is more of open habitats, we saw a decrease of 44% in the abundance of this species in almost 44% of the entire region, which is a lot. When we look at the other species, that is a more afforested species, we see that almost 50% of the region can show decreases in the abundance of this rodent. And in some places, this reduction could reach up almost 98%. So if you look at the number, the abundance of this rodent, and this is per pixel, so it's studied by 30 meters, before I restore, I had almost 100 individuals in those pixel size. And after the potential restoration, this could decrease to 10, which is a huge decrease. And because people get infected when they encounter feces or excreta of those rodents contaminated in the environment, if I decrease the abundance, the chance of a person to encounter those excretas are also going to decrease, and the risk is also going to decrease. So this shows that one, forest restoration could be a potential measure to decrease hantavirus transmission risk. And because for those rodents, doesn't really matter the spatial configuration. If I need to choose that I need to do a land use planning or I need to do a landscape restoration process, I could do in any way. I could do by increasing the size of this forest fragment and just making bigger and bigger, or I could do it by connecting corridors, connecting forest fragments, by planting small corridors or stepping stones or these small forest fragments in the middle of this matrix. And this is great because it's an evidence that forest restoration could really help or could really prevent zoonotic disease transmission. However, this is not that simple. So when we start looking at other diseases, and this is with yellow fever virus that has mosquitoes and monkeys involved in the cycle, especially this monkey here, the holler monkey, we see that we have a different response. So in this study, we were really trying to understand how the virus was moving through the landscape, because we had a terrible outbreak in 2017 in the state of São Paulo, Brazil. And we had those monkeys. So when they get infected, they get really sick and they die in 2 or 3 days, and they act as sentinel. So they are the ones that tell the health secretary that the virus is arriving, and then they start organizing the vaccination campaigns to really protect people. In this case, in this year, we didn't have enough vaccination, or enough vaccines to really vaccinate everyone. And we needed to understand if a virus was arriving here, through where it was moving and at which time it was going to arrive in certain places, so we could prepare all those campaigns to really try to protect those people living in those cities. So our main goal was really to try to understand and predict that. And we saw that the virus could move on average 1.5 kilometers per day. However, during the summer, it was moving almost 7 kilometers per day, which is really fast for a mosquito. And then normally the mosquito or the virus arrives in a forest fragment and stays 7 days, and then it moves again. Potentially because we believe that is when they don't have any more food, because they are really attracted to those monkeys, and the monkeys end up dying after 2 or 3 days of infection. So potentially they will need to move to find shelter and food in other forest fragments. And when we look through where those mosquitoes or virus was moving, we saw that on the opposite side of the hantavirus, for this disease, the configuration is really, 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 really important. So when we had those large blocks of forest, it was when the landscape was able to restrain the movement of the virus and protect, so it was acting as a barrier. However, when we had a lot of those small corridors connecting several forest fragments, or those stepping stones, especially close to roads, because they could just use the forest edge close to roads and just use the wind to move, it was when we had the higher risk. And it was how the virus was moving to other places. So what we take from that? One, that if I need to do a forest restoration program and I need to plan on how to do it, and I want to keep the risks of both hantavirus and yellow fever virus low, I really need to plan the spatial arrangement. So it's not only increasing the amount of forest cover, but also understanding how I can do that. So if it's hantavirus, doesn't matter. I can do in any way that I will keep the risk low, or I'll potentially keep those risks low. But if I want to consider yellow fever virus too, then the best way to do it would be to avoid this more connected landscape full of corridors that are great for conservation, and doing this more land sparing approach, really trying to create one big block of forest. And this shows that we have several trade-offs. So when we start looking at other diseases, we see that every disease has a different landscape signature. And it's really, really, really hard to try to understand how we can plan and really restore or deforest a landscape to really be able to keep all those risks low. So for example, in here, we are using human cases, so which is a little bit different because we are including exposure too in these landscapes. But a high risk landscape for the spotted fever, that is our Lyme disease, it would be a highly connected landscape, the same for yellow fever. However, when we talk about leishmaniasis, it's the opposite. When I have those clusters of forests is where I have the higher risk. And this is like only when we talk about zoonotic diseases. When we start talking about other health aspects, it gets more complex. So for example, we are trying to understand how those fire-related diseases, how landscape could affect those fire-related diseases in the Amazon. And I don't know if you know that, but every time we burn a forest, we release lots of toxic pollutants, especially the PM 2.5, that is very, 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 very small and can travel kilometers and kilometers away and make people sick even far away from the fire event. I know that we all hear about or feel the toxic haze that happened in Canada. I think it was last year, that was all over New York. It was horrible. So this happens all the time. And here, for example, is for the 2019 fires in the Amazon, that it was when it started like a very, very, very bad fire because of the new government. And we show that on these crosses, they represent the place that we're burning. And here we can see that higher the purple, higher the concentration, in this case, of the carbon monoxide. So we can see that because of the wind, it just moves kilometers and kilometers away. And it can really get people sick, even really, 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 really far away from those events. So every time we breathe those toxic haze, especially this PM 2.5, we breathe that too. And because it's so small, it just gets like stuck it or just enter our circulatory system. And then we start having both pulmonary and cardiovascular diseases, asthma, heart stroke, and like more than 24 diseases that can be related to that. And if we are exposed to that every year, we have a higher chance of getting those chronic diseases in the future too. So this is a high risk. And in this case specifically, we're trying to understand what would happen if we deforested all the indigenous land in the Amazon. And this happened because when we had our new previous government, one of the main discussions and one of the main think, law that he was trying to incorporate was to just get rid of all the indigenous lands and just deforest all of them. So we were trying to understand if the protection of those indigenous lands in the Amazon would have a health benefit, protecting people from those fire events. And then we saw that every time we burn 1 hectare of Amazon, we can create 641 new fire-related diseases in the Brazilian Amazon. We saw that there is a very strong relationship between those diseases and forests. So higher the amount of forest area, lower the chance of you really get sick, potentially because those forest areas, they can absorb pollutants. So they do absorb a huge portion. We don't really know how much of this PM 2.5, and then we end up having lower pollutant to be exposed to. However, when we look at this spatial arrangement, we see that those landscapes that are more fragmented, they have a better health outcome. And this is potentially because I have more edges, so I have more interface between the air and the forest, so I have a higher surface, area surface for the leaves to really absorb those pollutants. So I will have less pollutants in the air, and also I will have more people living in the middle of the forest. So they would be more also exposed to the service that those forests they are providing. And just one note that every time we burn 1 hectare of Amazon, we also get at least 50 indigenous people living in indigenous lands sick. They have nothing to do with that. They're there protecting their lands, and they also get sick. So this shows that even when you burn a place in one region, we can get people sick kilometers and kilometers away. So this shows that if I want to do a land use planning, trying to incorporate several health aspects, I will never have a perfect landscape. So it's really, 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 really hard to plan for this healthy landscape and to really restore forest areas, incorporating everything. I will always have a trade-off. And what is important is really to understand what are the potential negative outcomes, because we can avoid exposure, for example, through behavior change, use of protective measures, vector control. So this is not a reason for us not to restore, it's just to really understand what we need to do to make sure that we're going to keep those risks low. And this is really important because we are in the UN Decade on Forest Restoration, Landscape Restoration. And we have the Boom Challenge. We have a huge discussion about forest restoration. It is the target 2 of GBF. And we have a goal to restore 30% of all degraded ecosystems, because estimates say that at least 20 to 40% of the global land area is degraded. However, when we look at studies and we try to understand how forest restoration would affect human health, and this was just focusing on zoonosis, there is almost nothing out there. When we really try to understand, because all this that I was saying was not, we were not really evaluating restoration per se, we're just looking at the landscape and making assumptions of what would happen if I restore a site. So when we really try to understand what the evidence says about restoration and human health, one, we have nothing, almost no study published with that. The ones that were published, they really don't consider the context. So when they talk about restoration, we don't know how much forest cover we had before the restoration, how much were restored, how was the degradation of those areas. It was highly degraded, because all of this is going to impact the return of those fauna communities and of those ecosystem services that can be provided by these new forest areas. And this is a hypothetical conceptual framework that we put together, like trying to merge all of these, where we believe, and this is our hypothesis that we are trying to test now, that if we restore in a landscape that has a low amount of forest cover, like 10%, you need to restore a lot to be able to start having decreases in the risk of those diseases. So it doesn't matter the way you are going to restore, you're always going to increase the risk, or you just restore half of this landscape. If you have an intermediate amount of forest cover, we really need to plan and make sure that we're going to using the best spatial arrangement that could potentially benefit more diseases or benefits in the sense that is going to avoid the negative outcomes. And if you have a lot of forest cover, you won't have any risk, so you can do it anyway. But this could help to prioritize places where the forest restoration happen and how you need to do it in each landscape type. And this is what we're trying to understand now in a project that is called ZooHash, where we're really trying to understand how both habitat loss and forest gain is affecting rodent-borne diseases, all the pathogens that they carry, so all those like networks of interactions, and the risk for people. And what we're seeing now, and I'll be very fast because I know that I'm talking too much, is that one, when we only look at the composition aspect, that is this graph, and this Oligorismus nigripis is just one of the most important rodents that can transmit disease. So I'm just taking this number here. When we have more forests, I have a higher abundance. When we just look at the spatial arrangement, when those forest fragments, they are highly connected, I also have a higher abundance. But when I look at all of this together, and I put this because we were controlling several aspects of those landscapes, we see that in fact, the higher abundance of these species is when I have 40% of forest cover in the isolated forest fragments. So this shows that one, we need to look at those things together. We cannot ignore one or the other because they really change all those responses. So we really need to integrate this when we are looking at forest restoration. And we are also seeing that we have a large amount of an old forest that could provide this rewilding for this new forest. I could potentially richness and then potentially in the future decrease the risk because I will have a higher chance of restructuring those fauna communities in a more complex way that could potentially generate a dilution effect for those species. But then when we look at tick-borne diseases, it's the opposite. When I have more forest cover, I also have more rodents being carrying more ticks, and this could also potentially be a risk for tick-borne diseases. So it's not like there is no one solution that fits all. And we also believe, and this is something that we are testing now, is that we will have this like a threshold when you start restoring. That is not really restoration yet, but is the restoration path. It's going to take a while for you to really return those ecosystem services and really be able to keep those risks low. So we don't know how much time is going to be dependent on how long it's going to take for this new forest to be complex and bring all those fauna community back. But it could take potentially 20 to 30 years. We have no idea, but this is what we're trying to understand, because during this process, we can also avoid risks, cutting exposure or trying to do some behavior change, protective measures. There is several ways we can avoid those diseases. And this is what I had to say. Thank you. And if you have any questions, and I'm sorry that I think I'm over the time. I'll stop sharing my screen. So.
We have just a few minutes for questions. So I said I would come up to make it easier perhaps to facilitate the Q&A. So I'd invite any questions from the audience. And while we're thinking about those, I'll ask one. So Paula, thank you so much. I'm wondering, a lot of your research is focused in South America. Here we are in Massachusetts, and I'm wondering if the mechanisms and concepts that you're talking about, are they all the same here? Are there some differences? Any thoughts?
So we are seeing that there are several studies in New York, for example, that are looking at that, and they are very similar. So for tick-borne disease, when you increase the connectivity of the landscape, especially in an urban context, you increase the risk of Lyme disease too, because you increase the movement rate of the deer, and then it can really carry ticks all over the landscape and infect more people. So it's very similar to yellow fever. So the next step now, what we're planning to do is guidelines or like a report where we're trying to put all this together. So tropical forest, grasslands, case studies from different regions of the world to really try to see the general pattern and really try to understand how we can create guidelines to restore forest areas, to try to keep transmissions risks low. And even if it is not possible, but just like flag those trade-offs and potential measures that could be taken when you have a trade-off.
Thank you. Yeah. Can you apply this same study to rabies?
Rabies, so there is nothing with rabies and restoration specifically. And I also not a very expert in rabies, but I can look and send to you. But I never read anything about rabies and landscape restoration or connectivity. It's mostly how you're using like the anthropogenic habitat close to the forest that can attract the bats normally when we're talking about the bat-related rabies. But I can try to find something and send to you.
Thank you. It's a great question. Yeah, Carly.
How do you get like this information out to like the general public, and how do you kind of get like the public on your side for this type of stuff?
So depend on which public you are referring. So general public, we normally work with an NGO that has like an is a communication NGO that works with Instagram influencers, and then they understand the message and then they send the message into their Instagram's account to the general public. But we are really careful to say, because it's really complicated, because a lot of people think forest restoration or landscape restoration is so expensive that it's not worth it. So if you also say that it can have negative health outcomes, this could be a very negative thing for the restoration. But what we always say is that one is always going to be positive in the long term if you restore what you should be restoring. So it's not, what is happening is that it's so degraded and it's so easy to degrade in the forest that you lose so many species that it's really hard to go back to the more preliminary, like natural state. So this is what we're trying to do, and maybe we're going to face challenges in the way. But this is not a reason to stop and not do it. It's just like be aware of the challenges, be aware of what can happen, work with that, and then in the long term, you have always positive health outcomes if you keep doing and really do a landscape planning before you do that. So we always try to bring that message and always frame the positive outcome more than the negative one, especially for the general public. For the decision making, we are always working with WHO, WOA, and we are at every COP trying to incorporate these into the discussions. So there are a lot of people is talking about that, but now we need to start creating guidelines and really trying to understand how we can do it. So we know that we have potential negative outcomes, but how we can do it to minimize them. So this is what we're really trying to do, putting a lot of stakeholders in the table and really trying to provide an answer for people that are really doing restoration in the ground.
I have another question about, there's just sort of one sort of bullet point in one of your slides about silviculture, and I'm wondering, in addition to the questions about deforestation and reforestation, is there also research on sort of the forest management and how that may affect these diseases?
There is a lot of research on forest management, especially when we talk about decreasing the amount of invasive species or like trying to take like bushes, like it's a different approach. And normally it has a very positive health outcome when you restore and you just do a forest management that is going to incorporate only native species. This is what we're seeing, but also is not really, there is no really control to understand the context. If the disease was there before, it was integrated after this like different forest was there. So we really don't have a baseline. We just see that there is a decrease, but with forestry, for example, there is almost nothing.
Any final questions?
joining us. We really appreciate it. The fascinating research. I think that will be more and more important in the coming years. So appreciate you sharing your expertise. To the audience, thanks for the great questions. Come join us again next week. Thanks, everybody. Great.